Hi everyone, I'm Glenda Domingo and I will be your student nurse for today. So now we were performing giving a bed bath, assisting with bedpan and urinal, and providing a back massage and occupied bed making. So goal, the expected outcome to achieve the bed bath is when the client will be clean and fresh. Step 1. Review chart from any limitations in physical activity. Identifying limitations prevents patient discomfort and injury. Step 2. Bring necessary equipment on the bedside table or stand. Bringing everything on the bedside conserves time and energy. And arranging items nearby is convenient and saves time. Step 3. Perform hand hygiene and put on PPE if indicated. Performing hand hygiene prevents the spread of microorganisms, and PPE is indicated based on transmission precautions. So now we were performing hand hygiene using alcohol-based hand rub. Then put on gloves. Kakat ko na lang. Step 4. Identify the patient. Discuss the procedure with the patient and assess the patient's ability to assist the bathing process. So, identifying the patient ensures the right patient receives the interventions. So, discussion promotes reassurance and provides knowledge about the procedure. So, good morning po ma'am. I'm Glenda Domingo and I will be your nurse for today. So, can I ask your name and your birthday?
Donna Balicamo, January 1, 2000.
Okay po. Pakituloy. Okay po, thank you po. So, ngayon naman po, didiscuss ko lang po na okay lang po ba na paliguan ko po kayo? Wala naman po kayong any injury. Kaya niyo po bang iangat yung balakang niyo po? So, wala naman po kayong mga allergy about sa mga soap, yung mga sabon po, gano'n.
Wala po.
Okay po, sa mga pamahid po, sa mga lotion, wala naman po kayo allergy. Okay po, thank you po. Step 5, close curtains or doors if possible. Then, this ensures the patient's privacy. Then, adjust the room temperature and this lessens the risk for body heat during the bed bath. Step 6, remove sequential compression devices and stockings from lower extremities. Most manufacturers and agency recommend removal of this device before bed bath. So ngayon naman po ma'am, ask ko lang po kung may mga suot po ba kayong stockings.
Wala po.
Check ko lang po.
Glenn.
So since wala naman po yung suot na stockings yung patient natin, so wala na po tayo i-remove. Step 7, offer patient bedpan or urinal. This voiding or defecating before the bed bath lessen the likelihood that the bath will be interrupted. Step 6, unless contraindicated, apply powder to the rim of the bedpan. Then, cover the chair next to the bed. So, powder helps keep the bedpan from sticking the patient's skin and makes it easier to remove. So, since naas na natin yung patient natin na wala siyang allergy sa kahit anong mga gagamitan sa ating bed, sa ating skin, so pwede natin siyang lagyan ng powder sa gilid ng bedpan. Step 7, adjust bed to comfortable working height, usually in a elbow height of the caregiver. So, place the patient in the supine position with the head of 30 degrees. Then, having a bed at the proper height prevents back and muscle strain. Supine position necessary for correct replacement of a patient in the bed. So, since wala po tayong, hindi po adjustable yung ah, bed natin, so assume na lang po natin na elbow height po natin siya. Then, ma'am, pwede ko po ba kayong i-assist in a supine position? Okay, sige po. So, assist ko lang po kayo. Okay lang po. Sige po. So, Step 8. Fold top linen back just enough to allow replacement of bed pan. If there's no waterproof pan on the bed and time allows, consider replacing waterproof pad under the patient's buttocks or before placing bed pan. Folding back the linen is in this manner minimizes unnecessary exposure while still allowing the nurse to replace the bedpan. The waterproof pad will protect the bed. So, okay lang po ba, ma'am? Lagyan ko lang po kayo ng bago po tayo mag-bedpan. Okay lang po. So, kaya niyo pong iangat yung balakang niyo po. So, step 9, ask the patient to bend the knees. Have the patient lift his or her hips upward. Assist the patient if necessary. The nurse uses less energy when the patient can assist the replacing some of his or her weight to the heels. So, ngayon naman po, ma'am, maglalagay lang po tayo ng bed pan. Okay lang po. Then, ibebend nyo lang po ulit yung knees nyo. Okay po. So, Step 10 ensures that the bedpan is in the proper position of the patient's buttocks. Then, having the bedpan in the proper position prevent the spill onto the bed. So, ngayon naman po, ma'am, check ko lang po kung nasa tamang position po yung bedpan. Okay dito. Step 11, raise the head of the bed near of a sitting position. So, this position make it easier for the patient to avoid or defecate. So, ngayon naman po, ma'am, gusto niyo po bang ipaupo po kayo? Lang po. So, comfortable naman po kayo. Step 12, place bell and toilet tissue within easy to reach. Place the bed towels position. So, falls can be prevented if the patient does not have to reach the items. So, ngayon naman po, ma'am, iwan ko lang po yung call bell para po pag tapos na po kayo. Then, ito po yung toilet tissue and yung yun. Thank you po. Step 13, remove gloves and additional PPE if used. Then, perform hand hygiene. Performing hand hygiene prevents the spread of microorganisms. And removal of PPE prevent the transmission of the microorganisms. So, since hindi po ulit natin na-adjust yung bed natin, so hindi natin siya ma-adjust sa working height. So, imagine na lang po natin na na-adjust na po natin siya. So, step 15, lower the head of the bed if necessary. Then, remove the bedpan in the same manner. So, ask the patient to bend the knees and lift the buttocks. So holding the bedpan steady prevents spills. The nurse uses less energy from the patient, can assist by the placing some of his or her weight on the heels. So ngayon naman po, ma'am, tanggalin ko lang po yung nasa. Then tanggalin ko na po yung ano po. Then nyo po ulit yung missing. Step 16, if patient need assistance with hygiene, wrap a tissue in your hands. Then wipe the patient clean using one stroke. So clean area from front of back minimizes recall contamination of the vagina. So ngayon naman po, ma'am, angat nyo lang po ulit. Then po nasa ito. Step 17, do not place the toilet tissue in the bedpan. And place toilet tissue in appropriate receptacle. Mixing toilet tissue with the specimen makes laboratory examination more difficult. So, sabi daw, wag daw po natin ilagay yung tissue sa bedpan. So, dapat may iba tayong lalagyanan ng tissue. So, lalagay lang po natin siya, hiwalay po siya sa bedpan para hindi mahirapan pagka kailangan ng examination sa poop ng patient. Steps 18, return the patient in a comfortable position. Then make sure that the patient linens are dry. Then replace or remove the pad under the patient. So remove your gloves ensures that the patient is covered. So positioning helps to promote patient's comfort, and removing contaminated gloves prevents spread of microorganisms. So, ngayon naman po, ma'am, ayusin ko na po kayo. Okay na po. Then, kunin ko lang po yung then remove the gloves. So, step 19, raise the side rails or lower the bed and adjust the bed. So, these actions promote the patient safety. And, so ngayon naman po, since wala po ulit tayong side rails, kunwari na lang po natin itataas yung side rails, then, iaayos po natin sa comfortable position yung bed po ng patient. So, step 20, offer patient supplies to wash and dry his or her hands, assisting as necessary. So, washing hands offer using the urinal helps prevent the spread of microorganisms. So, ngayon naman po, ma'am, gusto niyo po bang maghugas po ng kamay? Okay na po. So, ito po. So, okay na po kayo, ma'am. Tissue po. Then, kung kailangan nyo pa po ng wipes, ito po. Step 21, put on gloves and clean the bedpan. So, putting gloves prevent the spread of microorganisms and prevent the contact with other body fluids. Then, cleaning the bedpan prevent the spread of microorganisms. So, before cleaning the bedpan, so make sure na nalagay po natin yung poop niya or ano niya sa isang lalagyan dahil minsan po kailangan po natin siyang gamitin sa laboratories. So after po natin makuha yung mga nakalagay po sa sa bedpan natin, so lilinisin lang po natin siya, then iaano po natin siya sa water, then pupunasan po natin siya ulit ng tissue. pupunasan po ulit natin siya ng tissue. After po natin siya hugasan ng water, then okay na po siya. So, step 7 for urinal. Assist the patient in an appropriate position as necessary, standing at the bedside, so side lying, one side or back sitting in the bed with the head elevated or sitting on the side of the bed. So, this position facilitates providing and emptying of the bladder. So, ngayon naman po, ma'am, okay lang po ba? Assist ko lang po kayo. So, since nga pala, babae yung patient natin, so, bedpan po yung gagamitin natin, hindi po urinal. Step 8, if the patient remains in the bed, fold the linens just enough to allow for proper placement of the urinal. Folding back the linen in this manner minimizes unnecessary exposure while still allowing the nurse to place the urinal. Step 9. If the patient is not standing, have him spread his legs slightly, hold the urinal close to the penis, and position the penis completely within the urinal. Keep the bottom of the urinal lower than the penis. So, slightly spreading of the legs allows the proper position of the urinal. Placing the penis completely within the urinal and keeping the bottom lower than the patient's penis avoids urine spills. So, since babae po yung patient natin, so ang gagamitin natin sa pag-ihi niya ay bedpan po ulit. So, ma'am, lagyan ko lang po ulit kayo nito. Okay lang po. So, wait lang. Kaya niyo po iangat yung balakang niyo po. Paangat na. Then, place lang po natin ulit yung bedpan natin. Step 10. Cover the patient with bed linens. Covering promotes warmth and privacy. So, step 11. Place the cold bell and toilet tissue within the easy reach. So, falls can be prevented if the patient does not have to reach for items he needs. So, placing the bed in the lowest position promotes the patient's safety. So, ngayon naman po, ma'am, ito po yung mga kailangan nyo po. Tissue po and wipes po kailangan nyo po. Then, ito po yung cordon. Para po kung tapos na po kayo, kailan po. So, step 12, remove gloves and other additional PPE if used, then perform hand hygiene. So, this prevent the spread of microorganisms. So we were performing hand hygiene using alcohol-based hand rub. So, step 13, perform hand hygiene and put on gloves if indicated. Then, performing hand hygiene prevent the spread of microorganisms. And putting gloves prevent exposure to the blood or other fatty fluids. So, step 14, pull back the patient bed linens just enough to remove the urinal. So, covering the end of the urinal helps to prevent the spread of microorganisms. So, tanggalin ko lang. Step 15, return the patient to the comfortable position. Make sure that the linens under the patient are dry. Then remove gloves and ensures that the patient's covered. So, proper positioning promotes the patient comfort. Removing contaminated glove prevents the spread of microorganisms. So, ngayon naman po, ayusin ko lang. Tanggalin ko na po ang mga team. Ensure patient call bell is in reach. Promotes patient safety. So, since yung call bell po natin ay binigay po natin sa patient natin kanina, so, kayang-kaya niya po yung hawakan. Then, kung kailangan niya po is, kaya niya po ding tayong tawagan.